Assalamualaikum and hi. My name is Nur Nadia binti Nazri, and today I will presenting on the cardiovascular system with a special focus on the mediastinum, which is the anatomical space where the heart is located. This topic is very important for us as nursing students because a good understanding of the mediastinum help us identifying normal anatomy, recognize abnormalities, and understand many clinical conditions involving the heart, lungs, and major blood vessels. To begin with, let us first define the mediastinum. The mediastinum is a central, narrow compartment within the thoracic cavity. It is located between the right and left pleural cavities, which contains the lungs. In terms of boundaries, it extends from the thoracic inlet at the top down to the diaphragm at the bottom, from the sternum in front to the vertebral column, specifically the 12 thoracic vertebrae at the back. Because the heart, major blood vessels, and nerves airways are all located here. The mediastinum plays a vital role in both the cardiovascular and respiratory system. The mediastinum is divided to help us organize and understand its contents more clearly. An imaginary horizontal line is drawn from the sternal angle to the level between the T4 and T5 vertebrae. This divides the mediastinum into superior mediastinum and inferior mediastinum. The inferior mediastinum is further subdivided into anterior mediastinum, middle mediastinum, and posterior mediastinum. Each division contains specific structures and has its own clinical significance. Looking at the anterior and lateral views of the thoracic cavities, the lungs are located in the pulmonary cavities on the either side. The mediastinum lies centrally between them. The heart is located in the middle mediastinum enclosed within the pericardial sac. This central position allows the heart to efficiently pump blood to both the lungs and the rest of the body while being protected by surrounding structures. Next, the mediastinum contents. Firstly, anterior mediastinum. The anterior mediastinum is the smallest division of the mediastinum. It is located in front of the pericardium and behind the sternum. It may contain the thymus gland, which plays an important role in the immune system, especially during childhood and adolescence. As a person ages, the thymus gradually becomes smaller and is replaced by fatty tissue. Although this space contains fewer structures, disease such as thymoma can arise here and cause compression of nearby organs. Next, the middle mediastinum. Is the middle mediastinum is the most clinically important part of the mediastinum. It contains the heart, the pericardium, the ascending aorta, superior and inferior vena cava, pulmonary arteries and veins, tracheal bifurcation, primary bronchi, phrenic nerve. This region is essential for blood circulation as it houses the heart and major vessels. Any inflammation, fluid accumulation, or enlargement in this area can directly affect cardiac output and breathing. Next, the superior mediastinum. The superior mediastinum is located between the horizontal plane between T4 and T5. It contains many vital structures including the thymus, trachea, esophagus, arch of aorta, great veins, thoracic duct, and important nerves such as the vagus nerve, phrenic nerve, and left recurrent laryngeal nerve. These structures are responsible for air passage, blood circulation, digestion, and nerve supply, making this region highly sensitive and compression or injury. Last but not least is posterior mediastinum. The posterior mediastinum lies behind the pericardium and in front of the vertebral column, extending from T5 to T12. It contains the descending thoracic aorta, the exiguous system of veins, the esophagus, the thoracic duct, sympathetic and parasympathetic nerve. This region is closely related to the spinal column and autonomic nervous system, which control involuntary body functions such as heart rate and digestion. Next is mediastinum clinical pearl. Now, let us discuss a clinically important condition known as mediastinal syndrome. This occurs when mediastinal structures such as the trachea, the esophagus, the left recurrent laryngeal nerve are compressed, commonly due to enlarged lymph nodes in the superior mediastinum. As a result, patients may experience dyspnea due to airway compression, dysphagia due to esophageal compression, hoarseness of voice due to nerve involvement. These symptoms often indicate serious underlying disease such as tumors or infections. Another important concept is mediastinal shift, which refers to movement of mediastinal structures to one side. In pneumothorax or hydrothorax, the mediastinum shifts towards the normal side due to pressure from air or fluid. In atelectasis, where lung volume is reduced, the mediastinum shifts toward the affected side. This shift is an important radiological sign and help doctors identify lung pathology. In conclusion, the mediastinum is a central and vital anatomical region that houses the heart and many essential structures. Understanding its divisions, contents, and clinical relevance is crucial for accurate diagnosis and effective patient care. That's all from me. Thank you.